Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Monday, December 21st, 2020. This is the last scheduled COVID-19 briefing for this year. It's hard to believe we're just days away from the end of 2020, with a new hope for 2021. COVID-19 vaccinations are being administered right here in Newfoundland and Labrador and across Canada. I'm very proud of my wife, Dr. Allison Furey, who's been working in the COVID assessment clinic and got her vaccine Friday. She and others like her are setting a wonderful example as more vaccines are on the way. And here in our beautiful province, we have the luxury of many friends that many friends across the country don't have. We can get together with COVID-19 safety measures top of mind, following Dr. Fitzgerald's recommendations, and that is something we can all be grateful for, something we can enjoy thanks to all of you. Guidelines are one thing, but actually following them is another. And follow them you have. When mandatory masking was brought in, you responded, just as you have throughout, and just as you will continue to do. Thanks to the diligence of Dr. Fitzgerald and her team in public health, Minister Haggie, and everyone in the department, we are navigating the pandemic well. On behalf of all Newfoundlanders and Labradorians, I extend our deepest gratitude. I had an opportunity to visit the health department on Friday to personally thank the people there. It really struck me how dedicated our team is there. Many of them haven't had a day off since this all started. Likewise, thanks to all the frontline healthcare professionals, the essential workers, the teachers, and all the staff who make our schools safe, comfortable places for our children to learn. Your bravery and courage help make Newfoundland and Labrador a wonderful place for us all. Excuse me. Now I have to ask you all to keep it up. Be kind to each other. Follow public health guidelines and wear a mask. Keep your distance. Wash your hands. Celebrate the season in a 2020 way. Do not let your guard down. This holiday season could make or break us, and we need everyone working together, as we have, to control the spread of COVID-19 in our communities. Take care of your mental health as well, and know that you are not alone. And there are resources in place to help if you're not feeling so great. Newfoundland and Labrador, it's truly an honor to serve as your Premier, even in the midst of this global health crisis and global economic crisis. I'm proud to work for you and confident in our future. I hope all Newfoundlanders and Labradorians near and far can enjoy some quality time with loved ones in a quiet moment of reflection. It's been a tough year, and we've gotten through it together. Happy holidays. Thank you, and I'll invite Dr. Fitzgerald to share her update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province. There's one case in hospital, and the total number of cases in our province is 382. 347 people have now recovered, with 28 active cases. And in total, we have tested 70,502 people. I would like to provide an update on the situation in Harbour Breton. Public Health has completed their investigation and has deemed that the source of the cluster in Harbour Breton was due to travel. This is a relief in many ways, and the public health team in Central Health deserves huge kudos for their diligence in tracing back until they found the source. Thank you to the residents of Harbour Breton who came forward for testing, and over 1,000 people had, and followed public health guidance to keep their community safe. If we do not see any further cases related to this cluster by December 24th, then public health will declare the outbreak over. Today is known by many as the winter solstice, and while the winter weather is well underway in many parts of our province, today marks the first day of winter and the shortest day of the year. After today, each day will start to get just a little bit brighter, and I sincerely hope the same can be said about the COVID-19 pandemic. It has been a tough year, and while we are beginning to see the light at the end of the tunnel, over the holidays, remember to keep those who may not be with loved ones in your thoughts. Find ways to show them you care, because for many, the holidays are not as happy a time as they are for others. And COVID-19 is not making this season any easier. Even amidst the pandemic, there are many activities that we can do during winter that can help improve our mental health and well-being, and enjoying the outdoors is most certainly one of them. Our province has so much to offer in the way of outdoor activities. So this Christmas, consider how you might incorporate some of the outdoors into your traditions. A crisp walk with the family to look at the lights displays in your neighborhood, making snow angels or snow sculptures, snowshoeing, or having a boil up with your bubble. And while here on the Avalon, we may not have much in the way of snow, we can still enjoy the outdoors by taking in one of the many trails or simply taking a stroll in the woods. Embracing the winter season and all it has to offer in our province is yet another way we can learn to live with COVID-19 and our sometimes challenging weather. Enjoying nature and being physically active benefits our mental health and well-being, which will help us into the future. A reminder for those who may be struggling, the Provincial Mental Health Crisis Line and the Channel Warm Line are here for you. Bridge the Gap and the Department of Health and Community Services website also have many mental health resources to support you and your family. As this is our last briefing until after Christmas, remember that your actions have been our greatest asset against the virus throughout this pandemic. We need you to keep this up throughout this holiday season. Your respect for each other and our most vulnerable has been key to our province's success. Please continue to be mindful of people, space, time, and place throughout the holiday season. Keep the number of contacts outside your bubble as low as you can. Be sure any space you're in is large enough to allow for physical distancing. The longer your exposure to those outside your bubble, the higher the risk of infection. And lastly, indoor activities are higher risk than outdoor activities. Let this phrase, people, space, time, and place, help guide you and your family in holiday activities. Doing so will help to prevent outbreaks in our communities. Our continued success in controlling the spread of this virus depends on each of us. We can mitigate the spread, but only if we make responsible choices throughout the holidays. We do not want to see a spike in cases in January, so our decisions now will impact how COVID-19 looks in our province next month. Please enjoy the holidays, however they may look this year. But remember that the greater the number of people you interact with, the greater the risk of spreading COVID-19. So as always, continue to adhere to our public health guidance. Keep your close, consistent contacts to 20 or less. Maintain physical distancing. Wash your hands frequently and well. Wear a mask in indoor public spaces. And stay at home if you feel unwell, and call 811 if you have any symptoms of COVID-19. These are easy yet vital measures that continue to be our best defense against this virus until the vaccine is widely distributed and used. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory. The total number of cases in the province is 382. I want to take a moment to wish those who will be celebrating a happy Christmas season. I hope you get to spend some quiet time with your loved ones and some time to relax. It has been a hard year, and we all need a little downtime. As we move boldly into the new year, let us reflect on the perseverance, kindness, and fortitude that got us here. Let's put 2020 to bed and wake up in 2021 with the same grit and resilience that protected and supported us all. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. We'll now ask Dr. Haggie to say a few words.
Thank you very much, Premier. Before I start, I think I'd like to echo your comments. I think it's a time at the end of the year, hopefully, to be able to give some thanks and appreciation for the people of the province who have listened to Dr. Fitzgerald, and it shows when you look at 0 being our best mark for today, and hopefully that's a mark we'll continue to earn each day between now and the end of the year. I think it would only be fair to comment again about the superb efforts, really, of healthcare providers and essential workers from somewhat non-traditional fields who've really stepped up over the course of this last year. And it's really difficult to name them simply because I'm sure I'll leave one out, and that would be probably worse of any of the crimes I could commit. It's been a really difficult year, and we've all pulled together. I usually start with a clock, a calendar, so I've reset mine now. It's now day 6 of vaccination for the people of this province. Over the course of the weekend, and 972 vaccines were administered up until close of business on Saturday, marking the start of a test run for our vaccine and delivery mechanism, which as the new year comes, I think will then allow us to get this vaccine and the ones that will follow it out into the arms of Newfoundlanders and Labradorians, starting with our most vulnerable and most at risk. I think Dr. Fitzgerald has dealt with the concerns around Harbour Breton. They have, as a community, had some challenges, and I've seen some rather unfortunate correspondence sent to people in Harbour Breton, which is really most unfortunate. The definition of an outbreak closure in public health terms is 2 incubation periods from the last case. That date will roll round, all being well, on the 24th of December. The only change I think that will happen on that date will be in terms of visitation at the long-term care area within the Conagra Health Centre, where we will go back to our pre-cluster arrangements rather than the more limited visiting, conscious that it is Christmas and families will want to reunite in a careful and thought-out way. Over 1,000 people tested in Harbour Breton alone, which is a significant percentage of the community. And the source has been finally traced back through many interesting steps, which one day will be told to travel. And I think on that, it's important for me to repeat some comments I made about travel last week, because, again, I may have missed some of the audience, judging by comments on my social media around travellers coming into the province. Obviously, residents, ordinary residents in the province, have a right of return, and as long as they follow public health guidelines, that's not an issue and never will be. I think the concern in other people's minds has been around travellers from outside the province, and I think it's important to realise that Newfoundland and Labrador is a province with a lot of contacts across Canada and across the globe, and close family coming home for compassionate grounds or care grounds will be a significant number when you look at the percentage of people we have travelling here. So someone coming in from outside obviously carries the risk of bringing the virus with them, and that's the importance of public health measures. Other reasons for travel from outside the province or outside the country, I've referenced critical infrastructure. I've talked about the Bliss Murphy Cancer Centre and some of our cutting-edge equipment here that requires service or maintenance from people with rare skills. We have people permanently relocating here who may, as part of that transition, be regarded temporarily as non-residents. And in addition to that, we have a whole group of individuals who may overnight in the province for warranted reasons. I'm thinking of our military, the Canadian Armed Forces. We have had overnight stops with delivery of a brand new search and rescue aircraft, for example, for the west coast of Canada from Airbus in Spain. So these people overnighted and took all the appropriate precautions. And there are humanitarian reasons for flights or boats to end up here, some of whom will unfortunately have COVID with them. And I think we need to be a little less hasty in jumping to conclusions and a little more compassionate and kind when considering the situation that other people might find themselves in here. The only other comment I would make about quarantine is that there has been a discussion as to when that period actually starts. It's really quite straightforward. The minute you step foot on Newfoundland and Labrador soil, the clock starts, and 336 hours later, 14 days by the clock, your quarantine ends, assuming you have had no symptoms at all. So again, follow public health advice. The year is coming to a close. The days are going to get longer from now on. And I would encourage everyone to do what Dr. Fitzgerald has said and what you have done. Hold fast. Thank you very much, Premier.
Thank you, Minister Haggie. We'll now welcome questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Linda Swain with VOCM. Please go ahead.
Good afternoon. How were you able to track down the source of the Harbour-Breton cluster?
So Public Health in Central Newfoundland, they questioned people who tested positive. They traced back their contacts. They traced back in the 14 days prior to them becoming sick, if they had been in contact with anyone who may have traveled, that sort of thing. And so then they in tracing back those contacts, can do testing in that situation as well. So it's every case is a little bit different, I guess. There's no hard and fast rules. It's just about asking the right questions and doing some investigative work.
Are there any concerns in this province about the new COVID strain identified in the UK, and do our tests pick up on that?
So the new COVID strain in the UK is, we haven't identified any here as that I know of at this time. That's not to say that there isn't any circulating. It's been in the UK for quite some time, so it certainly could be here. But it's, as far as we know right now, based on the information that we have, it does not appear that the test, the PCR test that we would use to test for this virus, is affected by that mutation. So it shouldn't affect our ability to detect that strain.
Thank you.
Our next questions are from Jody Cook with NTV. Please go ahead.
Good afternoon. I think, Minister Haggie, you touched on this a little bit, but I'm wondering if you could offer some clarification. In Saturday's release from the provincial government on the 8 new cases, there was an indication in the first paragraph that a number of people had left the province, or a few, I should say, had left the province who had tested positive. Can you just explain to us how you can test the positive and then be gone within this same time frame?
Yes. In general terms, because I can't speak about the specifics of any individual case, but there are at least 3 ways that you could leave the province with federal permission, because if it's international travel, you would need that. One of them is if you have access to your own aircraft. The other is if you have access to your own boat. And the third is if you are medevaced back as an arrangement by an insurer or another nationality or entity. So those are a knee-jerk response to that question in terms of at least 3 ways that I can think of, but I'm sure there are others.
Thank you. And in the conversation on this new COVID strain, just curious about the vaccine, and this might be, again, premature, but would this existing vaccine, be it Pfizer or even Moderna, which is now rolling out in the States, be able to protect against that? Or is this all just, sort of trying to keep up with the speed of this rapidly progressing scenario?
So that's a good question, and certainly one that we've been looking at. The indications right now is that the mutation that has occurred is not affecting the part of the protein that we have developed the vaccine against. Just based on sort of initial study and review, it does not appear that the vaccine will be ineffective against this newer strain. But we are still learning as time goes on. So, if we have more information at some point, obviously we will let people know that. But the initial thoughts right now is that it shouldn't affect the vaccine's effectiveness.
Thank you.
Our next questions are from Heather Gillis with CBC. Please go ahead.
Thank you. Good afternoon. So 972 vaccinations by the end of Saturday. I guess how many people will be vaccinated now over the holidays, and will that continue, or do we expect more people to be vaccinated now in the new year?
We have already arranged by Pfizer and Public Health Agency of Canada a similar number of doses or similar number of people we will be able to vaccinate over the course of the next few days. My understanding at the moment is tentatively our next scheduled shipment from Pfizer will be sometime between Christmas and New Year, maybe slightly larger. terms of more trade. At the present, we are still limited to administering that vaccine at the site of where the vaccine lands. So at the moment, we have not yet got our ultra-low freezers deployed across the province. The next one is in Goose Bay. I'm not sure whether that's been validated and set up yet. As soon, however, as Pfizer lifts those restrictions, and as soon as we have our freezers deployed, then we'll be in a position to spread out geographically as well.
Thank you. And on the Eastern Health After Hours Clinic that's closing, is that a right move for Eastern Health to do amid a global pandemic right now?
I think that's an operational issue. You'd be best addressed to Eastern Health. My understanding is they have reasons for it in terms of using the resources for different groups of individuals. So I would address that question to Eastern Health.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello. We've received a complaint on something that I personally witnessed as well, and I'm just wondering if you feel it should be addressed. This is people who are lined up to get into a hospital. So some of them often are not wearing masks, since one is going to be handed out anyway, and they're not physically distancing. Should that be addressed? It seems like it should be.
Sorry, the question, Peter, is people entering hospitals are not following the rules? Is that your question?
In the outside and in the foyer, as they're waiting to be handed a mask, several people are not wearing them. They're not physically distancing. I know I've witnessed this myself. We've also received a complaint on it.
Well, that's certainly something that should be brought up with whatever hospital you were visiting or the complaint was made towards, that regional health authority. Certainly we've been providing them guidelines, and I know when I was working there, they were being followed very strictly, but if there's been a lapse, then that's certainly something that the regional health authorities need to make sure the rules and guidelines are being adhered to.
Okay. And I wanted to ask as well about Harbour Breton. For a long time, we had 6, if I'm not mistaken, we had 6 cases of unknown origin. That now says 7 on the graph. I'm assuming that 7th is one of the Harbour Breton cases. So does that mean that we've had no community spreads for several months?
So there's been no non-epi-linked cases, of course, and no broader community transmission. But technically, when we have spread, from one person to another, that's community spread because it's spreading within the community. But we know where the sources are, right? So it's a little bit different. But we haven't had any non-epi-linked cases or widespread community transmission. Yes.
Okay. Thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
I'm curious as to whether or not any positive cases of COVID have been identified as the result of any of the travel advisories issued following some of these travel-related cases.
Sorry, Janice, after you.
Oh, yeah. No, with respect to the planes, you mean? Flight advisories?
Yes.
Yeah. To my knowledge, we haven't had any positive cases as a result of any of those advisories. But I will follow up to confirm that for you.
Do I get another question?
You do. Go right ahead.
Minister Haggie, here's your chance now. You indicated last week that day passes to allow residents in long-term care to spend some time with their family at Christmas would be something that would require some consideration. Now we're hearing that residents are being allowed to go out shopping or visit restaurants, and that has some people with loved ones in long-term care extremely concerned. What's your response to that?
Excuse me. I'm aware that long-term care facilities, in discussions with local public health, have made some arrangements to try and make Christmas a little more Christmassy for residents in long-term care. The issue around how that is managed and the PPE, I think, is an operational one. and I would direct you to whichever long-term care facility you're concerned about.
Thank you.
Our next questions are from Jody Cook with NTV. Please go ahead.
Thank you. I think the media is aware of sort of what the schedule and strategy is here over Christmas, but for the public who have been following this so faithfully, can you just let us know a little bit about how this is going to be delivered on a daily basis over the next few days for people to be able to get their numbers and check in to find out what's happening on the COVID watch here in Newfoundland and Labrador over the Christmas holidays?
Yeah, it'll be very similar to the days when there's no media brief. So there'll be a release that goes out, no different than on a Thursday or a Saturday. And if there's need for, heaven forbid, there's need for further information, then we will be make ourselves available. But none on the no briefing on the statutory holidays of Christmas Day or Boxing Day, unless absolutely necessary for some reason.
All right, and I guess for my last question, this has sort of been almost 10 months in the making as we round our mark on ending out the year 2020. You had, Premier Furey, you had the opportunity to visit some of your colleagues and some of the folks within the healthcare system. You alluded to that earlier. What is it that you want to say to people who are working within the system and the residents of the province who have quite literally almost marked a year under this COVID-19 here in Newfoundland and Labrador?
Well, yeah, thanks for the question. It was quite heartwarming and emotional for me to see the people on the front lines, many of whom were my direct colleagues who get the vaccine the other day. And I think we all owe the people, the women and men who go into the hospitals every day, not knowing, even as we're experiencing low numbers, still not knowing what risk is there for them and their families. Yet they still go in day after day, night after night. The hardworking women and men in the healthcare system who are on the front lines, keeping us all safe. So I all think that we owe them a great debt of gratitude, and equally to the people of the province who have put in 10 months. Again, it's Dr. Fitzgerald's rules and guidelines are only as good as people who follow them, and the people in Newfoundland and Labrador have shown their will and their collective responsibility in responding, not for their own sake, but for their neighbor's sake and for the collective responsibility of society. And I think that's not only something I'm proud of, it's something that everybody should be proud of, and in fact it's the envy of the rest of the country and perhaps the world. So my message would be to just keep doing what we're doing. And we will get through this as more vaccines roll out. We will come out the other side.
Thank you.
Our next questions are from Heather Gillis with CBC. Please go ahead.
If that new strain of the COVID-19 virus does make its way here to the province, will that change any of the public health guidance that we should be following?
So the new strain is the mutation causes it to be more easily transmissible, which obviously is that's significant. So I think if we do see it here, we have to follow those rules as closely as we can. So that physical distancing, wearing our masks out in public, making sure that we're keeping our contacts as low as possible. All of those things will still apply, and really even more important than to stay home when you're sick and make sure that you get testing done if you do have any symptoms that are compatible with COVID-19.
And now that it's taken a couple of weeks to nail down the source of the Harbour Breton cases, does it mean that someone wasn't truthful about traveling, or can you enlighten us a little more about what happened there?
No, not at all. It just, sometimes people don't realize that someone may have been a significant contact at the time, and sometimes sometimes they just forget. We're going back 2 weeks. It's hard to remember what you did every day for the last 2 weeks, and sometimes things pop into their heads afterwards, or we find out different information from somewhere else, and so it just all kind of gets pieced together. So no, I don't think anyone did anything wrong at all. It's just these things these things are an imperfect science in some ways, and as much art as they are science. And when it comes to asking the right questions, and then people's memories are a big part of it. So, but I think the team in Central, they really hunted, and they asked all the right questions and got the information that they needed. It just sometimes takes a bit of time.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I've had a couple of questions answered already. I'm curious to know whether you have or would consider using hypnosis to find out who someone has been in contact with over the past couple of weeks, because I know I certainly would have trouble thinking of some of them.
Why not just download the COVID alert app, Peter? It seems a lot simpler.
I have one. I have it already.
Yeah.
Excellent. Well done. What we need now is to clone that thought and get it out there a bit more. This will be the best memory aid that I can think of, and probably the most reliable.
Yeah, we haven't considered employing Ravine just yet, I don't think.
No. And the other thing is, when are briefings going to resume in January?
The first week of January.
Okay. Thank you.
I will now go back through each reporter to see if you have one final question. Linda Swain with the OCM, do you have a final question?
Yeah, Ontario is going into full lockdown mode. Are we still hoping to avoid that scenario here, and what will be the threshold in changing any of our alert levels?
So we certainly do hope to avoid
Absolutely.
it. That's why we're doing all this hard work now, and while we're asking people to keep up those public health measures and to keep your contacts low and all of that. So, but if we obviously things would have to be fairly significantly different from where they are right now. It would we would, for the whole province to go into lockdown, I think we would have to see quite an extensive spread throughout the province. But, we're not, our aim is not to do that. Our aim is to do similarly as we did in Harper Breton, which was to test as many people as we can, to isolate, find those contacts, to quarantine them, to isolate cases, and to employ measures in those areas as quickly as possible. We've seen that's worked in other Atlantic provinces. We've seen our colleagues, our Atlantic colleagues, have good success with being able to control outbreaks when they've taken this approach. So that certainly would be our way forward from here.
Thanks. Happy New Year and Merry Christmas.
Yes, to you too.
To you.
And to you.
Jody Cook with NTV, do you have a final question?
No, thank you, but thanks to everyone on behalf of all of us at NTV on the panel for the often briefings. Thanks.
Thank you.
Thanks, Jody.
Heather Gillis with CBC, do you have a final question?
Yeah, just one more question on the international travelers who left here. I guess kind of what responsibility do we have to either notify, say, the home country or province that they're going to, or care for them if someone does arrive on our doorstep that is sick?
From the point of view of international travel, that would be partly conducted through Public Health Agency of Canada and federal authorities. Certainly, we as a provincial healthcare system would be happy to supply any information necessary. Obviously, if this was a medevac flight taking somebody back to another jurisdiction, that would be done on clinical criteria, and the receiving country would be well aware of the situation.
Thank you. Merry Christmas, folks.
Merry Christmas.
And to you.
Christmas.
Stay safe.
Peter Jackson with the Telegram, do you have a final question?
Yeah, I was wondering, have we noticed an uptick at all in the number of outbreak alerts that have been coming in from BC, Alberta, Northwest Territories, of that sort of thing?
Certainly, we have been seeing outbreaks coming through on a fairly steady basis. And I think if we compare to the summer, certainly we're seeing more now than we did at that time. But again, that's not surprising given what we're seeing with the epidemiology elsewhere in the country. So it's been a pretty steady flow of information in that regard. But to be honest, I don't have that information at hand as to whether there's a significant amount more now than say in the last month or so.
Okay, thank you, and I hope you all have a great Christmas.
Same to you, Peter.
And a happy New Year.
You too.
You too, Peter.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thanks to everyone at home for tuning in. What's definitely been an unusual 2020. But I really need to thank you all for, again, following the rules. And in true Newfoundland and Labrador fashion, we've recognized our shared responsibility to our neighbors, to our communities, and to our province. And it's the reason that we are the envy of the country right now. And that's because of you all. So please keep it up over the holiday season. Special thank you to Derek, who's been here behind the cameras every day, and every other day now, making this all possible so that people can be informed at home. And equally, thank you to the media, to each and every one of you for helping us communicate the science and not create myths, and for helping the people of Newfoundland and Labrador understand this complex issue that is COVID-19. You have a large part to play in ensuring that the public is well communicated, and you've done so. So thank you. This is time for us to not let our guard down, but hopefully everyone at home has a holiday season full of peace and love with their families. And please continue to be kind, and together we will get through this.
Thank you, Premier. Thank you, everyone, for joining us. Take care of yourself and each other, and have a safe and happy holidays.